I'm Dr. Mwebaze Raymond Mbayo. I am a physician working with here at Nsambya Hospital, which is a private mission-founded hospital in Kampala. I've been practicing here for the last 20 or so years. And in fact, as a physician, I've been practicing for over 15 years. I did a postgraduate diploma in diabetes, sponsored by Merck Foundation, nationwide diabetes hypertension blueprint program. Without such a scholarship, I'm sure I wouldn't have done such a super specialization in diabetes. Initially, I thought an online course in diabetes would be very difficult to conduct and maybe appreciate the nitty-gritty and details of diabetes and its related issues. But I found the training online, the engagement the tutors give you, the course content, the extent the course covers, very informative. And more so, me being actively practicing as a clinician, seeing patients on a day-to-day basis, running a diabetes clinic, I was marrying the two, the training and the practice together, and it made my understanding of the course, it made it more practical to me. Yes, on completion of this course, of course, this has given me all the confidence I needed to practice as a clinician who has now specialized in diabetes. I can confidently help my patients understand their condition and how best to manage it. But beyond patient management, this institution where I work, we have a postgraduate training school. I'm involved in teaching students in either during clinical work. I teach students about diabetes and its related complications. Pharmaceutical companies have involved me in making presentations on some of these new molecules in the management of diabetes, like SGLT2 inhibitors, incretins, and because of the confidence I've acquired from the course, I make presentations and I teach other doctors on such meetings. I'm involved in teaching young doctors, giving them the basic knowledge. Some of the young doctors, you find the initiation of treatment on diabetic patients is not very straightforward. Use of insulin is not very straightforward. So such interactions with a knowledgeable doctor, I mentor young doctors into diabetes management. It's as one of the diseases that is on the increase world over. Uganda has not been left out. And that said, there are not many clinicians who have really specialized in this management. And this was a great opportunity for me to train us more deeply in diabetes. And I've been a general physician for all this time, and I've not subspecialized in any specialty within medicine. So this diabetes is now my specialty as I grow into my practice. So I believe this will go a long way in improving the management of these patients who are on the increase per se. I personally, in this clinic alone, I run a Monday clinic in diabetes, and I see over 60 patients on a clinic day. After completing my postgraduate diploma, of course, through Merck Foundation, still I got a scholarship and funding to do my Masters of Science in Diabetes. And I should say thank you to Merck Foundation for this opportunity once again. And as we talk now, I've already completed and passed my Masters of Science in Diabetes. and actually I'm just submitting my dissertation. I did some work on an interesting topic, which is a new kid on the block, like one of my tutors was telling me, and that is the NFLD, non-alcoholic fatty liver disease. And the patients with diabetes are at high risk of developing fatty liver and its related cardiovascular complications. And this is one of the underdiagnosed, undertreated conditions in patients with diabetes. Definitely, I would recommend the young doctors to enroll on these Merck Foundation sponsored programs in the various specialties. I've done it personally, and I've been approached to make recommendations for some of these doctors.